to COVID-19. COVID-19 is a new disease. The situation is rapidly evolving and expanding. To date, Volusia County has one presumptive positive case. We've been preparing our response since January. The goal for us is to detect the virus and reduce the spread and impact. This is what we prepare for in public health. We are part of Florida's integrated public health system. We have already stood up our incident management team to focus on our rapidly changing environment. As of March 1st, that was when the first 2 cases were reported in Florida. That was in Hillsborough, Manatee. We have a 2051 directing a public health emergency, and the state surgeon general has issued a declaration of public health emergency in Florida. Instead of going over the China information, I'm going to provide a Florida update. So Hillsborough County patient was confirmed traveling to Italy within the last month. After that, which was this morning, which might have changed by now, Florida has 12 Florida residents that are considered positive. That includes the one here in Volusia. There were 5 Florida residents that are positive cases, and we have 1 person in Florida who's a non-resident that's a positive case. Deaths attributed to COVID-19. So far, there has been 140 negative test results in the state of Florida. There are 115 pending testing results. We have currently monitored over 1,000 people, 1,104. It changed since earlier this morning. And currently, of those 1,004, we are monitoring 302. That is for the state of Florida. So how do you get this disease? Your risk is dependent upon exposure. It's person to person. The best way to prevent the illness is to avoid being exposed to the illness. Most often, it's spread person to person among close contacts. That's within 6 feet. It's thought to occur mainly through the respiratory droplets produced when an infected person coughs or sneezes, similar to how flu and other respiratory diseases are spread. Symptoms are mild to severe and may appear within 2 to 3 days. No vaccine to protect against COVID-19 and no medications approved to treat it. So what we're recommending is that if somebody is infected with COVID-19, they should receive supportive care to relieve any symptoms. So as it stands, as of this morning, we now have commercial lab capabilities, but up until this weekend, lab testing was being done in Jacksonville, Miami, and Tampa, the public health labs. But I do understand that we do have some commercial labs, both LabCorp and Quest, that can do testing. So we have been collaborating with the Centers for Disease Control to conduct surveillance for persons who have been exposed or infected with COVID-19 while traveling outside of the United States to those impacted countries. Our efforts, again, are on containing the virus. So prevention. We want to prevent people from getting sick, and we want, most importantly, to protect our vulnerable populations. That's our older adults, along with those living with underlying medical conditions. So what do we do to prevent the spread of this disease? We wash our hands for at least 20 seconds. We use soap and water. We wash our hands constantly throughout the day. If we don't have soap and water, we use hand sanitizer. That's at least 60% alcohol. We avoid touching our face. Don't touch your eyes, your nose. Avoid close contact with people who are sick. Stay home if you're sick. Now, stay home if you're sick with a new onset of a medical condition. If you have chronic diseases or such as asthma that's going to create difficulty breathing, then you're able to distinguish between a new type of illness versus something that you've been dealing with. Cover your nose and cough when you're sneezing. Clean and disinfect frequently those objects that you're touching using household cleaning supplies. So the travel advisories, it's changing. It's changed already with other impacted countries. So what the Department of Health has determined that all international travel will be monitored. That changed since my discussion this morning. So I'm going to go through all that. So what happens when we're conducting monitoring? We receive information from the CDC about people returning from impacted areas. We then go out and we work with those individuals doing not only testing and monitoring for illness, but also isolating and then making sure that we do our contact tracing, which means anyone that they've been in close contact with since arriving back to this country or while they were who they were traveling with as well. The guidance that we're using is coming from CDC. I have the website up on the screen. We also have the Florida Department of Health has excellent material posted for businesses, employers, government, healthcare workers. So in Florida, the risk is low. But as more cases are identified, again, it's a changing situation, evolving every day. As I mentioned, we have the Florida Health.gov website for resources. We've also established a 24/7 call center at 1-866-779-6121, and also a email, COVID-19, and again, it's in the PowerPoint on the slide, and the CDC website as well.
Thank you very much. That concludes your presentation. I want to take a moment and thank Mayor Burnett for suggesting that we put this on the agenda. Are there any questions by any member of the round table? Comments? Yes, sir.
Yes. If someone suspects that they have this virus, should they call their doctor as opposed to going to the doctor or the emergency room to avoid spreading it?
Yes, great question. Thank you for that. So basically, we're in the midst of flu season, and if you look at the symptoms for COVID-19, they're very often the same as what we see with people with flu. So we are recommending that individuals who are ill that need to be seen by a healthcare provider, call that healthcare provider first if they're having symptoms such as coughing, respiratory issues, and things of that nature. And doctor will then make the arrangements if they feel like what we've been doing is testing for flu first, and then ruling that out as well as other respiratory illnesses. And then at that point, the COVID-19 test would be conducted. If there was no international travel, of course. And with the commercial labs coming on board, it's going to make, it's changed the availability of testing significantly.
Hey, Patricia, just out of curiosity, if you have any prevention or containment measures that you need assistance from cities. I see Jim Judge here. Are we going to use the usual emergency management channels for that communication? How does it work in this kind of environment? We're used to hurricanes. We're not used to dealing with public health emergencies. So I'm just curious how that process will work.
Well, it's wonderful being here in Volusia with all the partnerships that have been so well established because of our hurricane response. And so it's similar in that respect that we have all the partners working together. There's been a push to get as much information out to the public about how to prevent the spread of spread of germs in general, which will help contain this disease. And I know the communication personnel from all the cities are working with not only the Department of Health, but also with the counties. So I think at this point, you can go to CDC and look at the guidance for employers if you want to understand what you need to be doing in terms of when people need to stay home, or if they're planning a trip abroad, with them coming back, what does that mean in terms of self-isolating? So someone who is planning a 7-day trip may be looking at a more extensive time off. So I think from an employer standpoint, you should be reviewing not only your sick leave policy, but also what happens with fewer people out working, maybe because of illness or self-isolating.
George, does either you or Jim want to comment on
Good morning, everyone. Jim Judge, Volusia County Emergency Management. Of course, the Health Department is the lead agency for this health emergency. Patricia and I are working very closely together. We literally have daily conference calls. We're certainly talking over the weekend, but also we have a statewide call with the Florida Department of Health. Mondays and Wednesdays, Thursdays, we have a call with the Florida Division of Emergency Management. Right now, the communication center is very quiet. So that's when we use the calls coming in as a trigger for our Citizen Information Center. So with that Department of Health call center phone number, it's now 24/7, we're just not getting many phone calls here in the county. There's only one county in the state that's at a local state of emergency, and that's Seminole County. They decided to do that about 10 days ago. And the reason was they wanted to activate some of their memorandums of understanding. So that's the only county. All the counties are level 3, which is what we are, monitoring. The state went to a level 2 partial activation, as they just have a few of their emergency support functions activated. We need to get in touch with them. And of course, public information. Holly Smith with the Health Department, also Kevin Captain with the county, have been sending out a great deal of information, both over the volusia.org/PIN site, but we're also sending out a lot of information on web links, because the information is changing hour by hour, day by day. So it's important to just go to those links and go to those sites for the latest information. Patricia said as she was working on a program this morning, she looked over and some of the information had already changed. So we continue to put out a great deal of information. The Florida Department of Health website has a great deal of information on it. We do have a public information meeting next Wednesday. So we continue to monitor the situation. We also have our web EOC up and running. So that way we can monitor everything going on in the state of Florida, which the state and emergency management's assistants turning that on Friday. So that way we can keep up with all the things that are going on across the state. And again, as Patricia mentioned, just good old family planning, hand washing. When you have to use that hand sanitizer, remember that's only good for about 2 minutes after you use it. So don't ever miss a chance to wash your hands. Make sure you check that hand sanitizer to make sure it's still in date, because it does expire after about 3 years of product, because again, it loses its efficiency because the alcohol evaporates, and it actually can become toxic after a certain point. So a lot of little tips out there. We continue working on a city manager meeting tomorrow morning, conference call, we can continue to brief out. But again, Patricia and I continue to work in tandem, supporting her efforts and public information from both Holly and Kevin. Certainly I'll be happy to answer any questions.
Mark and Chris?
Yes, I've seen this, I saw this in your slide, and I know I had this question before, where you said always wear a mask around people and pets. Has there been any indication that this is transferred from pets to humans?
The mask for people that are sick, and someone who might be going through something like a cancer treatment or have some immune compromised. So There is a frequently asked question document on CDC, and the second to the last question on that document indicates that you could possibly spread this germ to your dog. I think it was from kissing or something that was mentioned on there. So, we're learning more and more about the spread of this disease. We know that the origin came from animal to person as far as the China story goes. But at this point, stop the spread of germs, including spreading, in our.
So the animal being around someone sick and then possibly going into another room with someone not sick, is that a way that it could be spread, maybe carried on them, or we don't know?
I don't know. I mean,
Oh.
there's so many questions that epidemiologists would ask of that person about the proximity of the contact, whether they were actually sick during the time. A lot of it depends on. We know that 80% of people may be exposed to this and not show any symptoms. So that's another part of this that's evolving and unfolding.
Chris Beer, Mayor of Holly Hill. Has the state or federal government indicated to you at all what area of Volusia County that this case is located in? And if not, could you tell us why?
Okay, so the state of Florida, I'm a state agency. I work very closely with my county. The Department of Health has determined that only the county will be provided to the public. Basically, if you look at any of the cases, Manatee, Hillsborough, you'll only get the name of the county. They're allowing us to share the gender, the age, and the county of residence. That's the only information. It really does protect the confidentiality of cases, whether it be a TB case, COVID-19 case, or HIV case. It's just, that level of privacy is practiced very often in public health when there's cases.
Joe?
Thank you. I don't see Dr. Springer here, and maybe Jim might have an answer. Will there be any change to how first responders are handling the change in protocol, to how first responders respond to a suspected?
Actually, Dr. Springer's been working with our first responders, fire and EMS, to make sure that they understand PPE, continuing to use your personal protective equipment. And of course, if we have a mask, we're going to put the mask on the individual who's ill, not on the responders, at least yet. But there has been a great deal of information shared, conference calls as well. So, Dr. Springer's been working with everybody to stay on top of that.
Jim, do we also change a little bit of the EMD process?
That's a great point, Mr. Reckenwald. Of course, we have the nurse triage program. So the state has pushed down information on, enhancing the screening of patients through the emergency medical dispatch. But with our nurse triage program, those calls can come to nurse triage. If you've got a high fever, a cough, have you had internet already exposures, and so all that. And then that information then can be transferred to nutrition staff that they can actually go to the home and do some testing at that point. There's a lot of information from the state that's come down to hospitals, nursing homes, adult living facilities. We've been in close contact with our adult living facilities and nursing homes, and also a lot of information coming down about visitors to those centers. So the precautions that they can take. So lots of information sharing going on out there, and everybody's been very, very proactive. Of course, we've watched this, when it first started. With the international travel, sooner or later, we're going to deal with it. Here we are. But luckily, it's an international travel case. I would tell you that when we get a cluster that tests positive with no international travel, then we're going to talk about partial activation, Citizen Information Center, and wrapping up a lot more of our activities.
I'm going to let Lisa Lewis ask a question because we've got an election coming up, and she has a question, and there are going to be a lot of people moving around. So.
Lisa Lewis, Supervisor of Elections, and that is my question. With our election, we're in the midst of early voting right now. People sit right across the table, to check in, and it can be one right after the other. We're getting calls from poll workers, and I don't want them to panic, and I don't want them to walk out and not come to work next Tuesday. So any suggestions that you would have on that close contact, because, you know, checking in a voter is right there with the even, taking it up to the machine, you know, we're trying to put into place, wiping down all, tolling those, the sleeves that are used, and with this election, there's only one race on there, they could actually do a face down, we could maybe do away without the sleeves, but I don't know, so.
I would recommend a lot of hand sanitizer and encourage them to get up and wash their hands frequently, not to touch their face, not to let it, you know, not to cough randomly, use the tissue or sleeve it when it's not available. And the hand sanitizer and clean the surfaces, I think is what we all are doing with public, I mean, many of us have public facilities and we have people in and out all day long. And it's, you know, the exposure is related to someone with, it's not just circulating in our environment. So the good news is hopefully the people that are not, that are sick will stay home and
And just so everyone knows, I am gonna put out something that if you're more comfortable bringing your own pen to sign, please do that when you come to vote, because we can print the ticket, you can sign that, you don't have to touch the screen or whatever. Okay.
so I would just keep everything as clean as possible and hand sanitizer. Just, you know, just have people be aware of their own environment and physical and you can't control the public.
Okay. Well, thank you all.
It's still flu season,
Yes.
so those precautions are wonderful. And even Donna Butler mentioned all the work that's being done at the libraries to make sure that they're, you know, cleaning up the folks and just the leisure precautions.
Thank you for your presentation.
Just a quick question regarding the testing. You stated that commercial testing is going to possibly be available coming up. Right now, I think for a lot of the general public, they may be going to the ER, contacting their healthcare provider, but right now, the only way to get tested if you fall within those parameters is through the health department, correct?
I was told this morning on a call after a meeting that the commercial labs are up. We were instructed last week when this discussion happened that it would take a clinician's recommendation, probably a lab order, to actually access that test. But right as of yesterday, we were going out, collecting a specimen and sending it to Jacksonville.
Okay, so that's good information.
Yes,
That it's
right.
going to be more availability to get tested, not only through the health department.
Correct.
Okay, thank you so much.
You're welcome.
Quick question. Commercial labs, do we know how many we have in the county right now that are capable of testing? How long does testing take? And do we have any definition on quarantine? What does the quarantine look like for any of the patients we want?
So right now, I'll start with the labs. When I heard about the commercial labs coming on board, I instructed somebody to go ahead and call Western Lab Corps to find out where in Volusia County that availability exists. So I don't know. I just know that as a state, they said that the commercial labs were coming on board. And then as far as quarantine versus isolation. So at this point, all of the cases that are self-monitoring have voluntarily isolated themselves. There's been no need to quarantine anyone. We would only use quarantine in the event that somebody was not going to cooperate. So it's been, well, everyone's been fully cooperating with us, and we monitor them daily as needed. So it's voluntary self-isolation.
Thank you again. We're going to move now to the American Flight Coalition presentation.